now. So if you can create a system or put out content out there that is legit and works great, there's value in that. The internet is huge now. Telehealth is coming. Big data and data analysis. What do I mean by big data? It's analyzing trends, analyzing stats on your website. I helped my father-in-law out with his charter business. He charters a boat out of Stuart, Florida. I can create a Facebook ad for $75, target everyone in a certain zip code who likes fishing, launch that ad for $75. I know that the average charter is $1,000. If I get 2 charters in 1 week off of that $75 investment, that's $2,000 coming into the clinic. I'm using Facebook and the data that they're gathering to target my target audience at a way cheaper rate than writing an editorial in a random magazine. That's what I'm talking about, big data and data like analysis. You know, we have to be tracking data, tracking our metrics if you're marketing to the public with direct access. So in a cash-based physical therapy practice, again, I said it already, if you don't get the patient better, they're not going to pay cash. So this system is built 100% based on results and performance, okay? So we're already in a production or a performance-based model, okay? We need to take advantage of technology and data analysis, tracking data on pages for marketing. Another specific example of what I do, on my website, I have a pixel code on all my hip pain pages. It's gathering data every month, people who clicking on my hip pain pages. After the data gets big, I can launch a specific Facebook ad directly to those people targeting hip pain and my hip pain treatment approach. And then they click through and I get people in for hip pain. I'm using technology and tracking data, people who are on my website searching for hip pain, and I target a marketing ad through Facebook targeting people specifically for hip pain. That's what I mean by analyzing data and advertising, okay? An example of this, again, is a magazine or Facebook. If someone calls me wanting to do an ad or an editorial in a magazine to target golfers or a local magazine, it's like, do I spend the $300 a month for 1 year and put an ad in a magazine? Or can I spend $300 on Facebook, target exactly who I want, and get a way better return on my investment, taking advantage of the data that Facebook's tracking? Because if you have a Facebook app on your phone, you have a social blueprint, and Facebook is tracking all of your data right now. Okay, there's pros and cons in that, and that's a whole another lecture. But we have to adapt to the times and learn how to market and get in front of our specific patients or prospective patients who are actively online searching for the resolution. Another thing is who's on Google and who's on Facebook, okay? In a lot of my teachings, if you're going to target a diagnosis, use Google. Everyone's on Google. I have neck pain, how to treat neck pain, best treatment for neck pain, Orlando, how to fix neck pain, self-home treatments for neck pain. People are actively on Google searching for resolution, whether in the pain awareness phase or solution awareness, they're searching for stuff. Facebook, someone's probably not searching on Facebook how to actively treat hip pain, lower back pain, but you can target groups on Facebook really easy. Runners, you can target runners on Facebook. You can target CrossFit athletes, niche markets. That's a much better way, an effective way to use Facebook instead of going after diagnosis bases, okay? So understanding the difference between Google and Facebook, it's taking advantage of technology and doing things better, faster, and easier, and getting a better return on your investment. So let's talk about the service industry. What's going on with the service industry? Because we're in service, just like dentists and lawyers and other professionals. You know, we're in the service industry, also in healthcare. So we can see here agriculture and manufacturing jobs are going way down, okay? But we're in the service industry, okay? So I think we're safe, okay? The future and the growth of the economy coming forward, we're going to be safe with our jobs. Now the real question is IBM Watson gonna replace us? Can we be replaced by a computer? This is where we have to watch in the future, okay? IBM Watson right now is working on an algorithm as a primary care physician. If they could actually work the algorithm and be more accurate than a primary care physician, that's a problem for the primary care physicians. If you can just walk up to a computer, type in your symptoms, and the algorithm has a better prediction rate of your probability of having a disease than a primary care physician, I think they're in trouble. And there's clinics that are already doing it. Remember that there was some clinic that Apple was starting to create out in Washington or Seattle or something like that, where it's like it looks like an Apple store, but it's a healthcare clinic. You walk in, you type your symptoms, you just put your hand in the sleeve, it takes your blood pressure, heart rate, and it looks like an Apple store, but it's a healthcare clinic. So we have to make sure that we do not get replaced by a computer. So we need skilled services that a computer cannot do. I think that we're safe, because a computer can't replace manual therapy and a lot of the interventions that physical therapists do. I believe that we're safe, but a lot of professions are going to be replaced by computers in the service industry, manufacturing, and agriculture. Healthcare trends. Again, I'm going to use the KISS principle on this one. What's the future of healthcare like? Okay, so we already talked about the horrible healthcare model. There is just straight dysfunction between the patient, the provider, and the insurer. Okay, and again, there's a reason why healthcare businesses are not on Shark Tank. Too many limitations, too many guidelines. It's just straight dysfunction. And there's a reason why you don't see healthcare businesses on Shark Tank. I used to have dreams of taking my cash-based clinic and being on Shark Tank. It was good as a business owner because I watched that show and it makes me analyze my stats, make sure that I know my stats, and if I was in that person's shoes presenting to the sharks, would they rip me apart? You know, do I have a good business? So I love this show for entrepreneurs, and if you're planning on opening a cash-based clinic, it puts you in that business mindset. Do you know your stats? Are you profitable? What's a good pre-tax profit margin? So I love that show for any of my cash-based practice owners. But again, healthcare in general, we need to solve this problem, or better yet, take out insurance. Go directly to the patient. Problem solved. Future trends in healthcare, we all know that we're going from volume-based to value-based already. We've heard about this, it's changing already. Whether you're in a nursing facility, a home health company, bundle payments are coming. Everything's going to be based on value, outcomes, keep them healthy and make them living, incentives. I have a program that I'm designing, it's called the Stay Out of the Hospital program. So I keep patients out of the hospital, out of physicians, out of surgery. So we're going from volume-based to value-based, okay? Health insurance companies are raising premiums, raising deductibles, co-pays are going up, co-insurances. Patients have no clue what a co-insurance is, and it's like a shock 3 months later where they owe another 10% of the actual bill sometimes. And declining reimbursement is going on in all aspects of healthcare. We know that this is going on. The interesting thing is, are insurances really going to value physical therapy? That's the big thing. Where is physical therapy going to fit in the future of health insurance? Okay, it may not be there. We may be viewed as kind of a maintenance service. Businesses, what are businesses doing? Okay, businesses are altering insurance plans and having more HSA accounts. So they're going to have more catastrophic coverage, higher deductibles, and you're going to be, the patient or the employee is going to be more responsible for the cost of their health care. And they'll have HSA accounts or flex spending accounts. So if you know that the patient or the employee is going to be financially responsible for their care, that's good for a cash-based clinic. And I'm going to go and show you why. ACOs are forming, they're dominating local markets, they're buying out clinics, okay? Again, where's the physical therapist going to really fall in this ACO model? Are they really going to take advantage of the direct access? Or are we going to be bottom of the totem pole again? So what does a cash-based physical therapy clinic answer when it comes to healthcare trends? Okay, we can decrease the cost of care for the patient compared to others. We have direct access to patients. We can go directly to them. okay? It's outcome-based. Cost effectiveness again. Again, an example is this. Say a plantar fasciitis patient, okay? You know that the patient has a $5,000 deductible, okay? They have to pay $5,000 before the insurance covers their treatment. They can go to the hospital-based system, it's gonna cost like $6,000. They're gonna have to max out that. They can go to a chiropractor for $4,000 twice a week for 8 months. They can go to another clinic for injections and that for $3,500. They can come to your cash-based clinic for $2,400. There's value there. You can save patients money in a cash-based clinic, okay? And the question is, if you're in your clinic now, what are you currently doing with your structure, your cost? Are you skating to where the puck is, or are you skating to where the puck's going, okay? So we have to know these future healthcare trends so we can adapt and be proactive and be ahead of the schedule, predict things that are coming, and so we can adapt to trends in healthcare and the marketplace. Okay. Speaking of the marketplace, so for those who are students who aren't really business savvy too, like the marketplace is everyone in your business and competition. Like for instance, like Crest and Colgate are in the toothpaste marketplace. Hilton is in the hotel industry marketplace, okay? If you want to look at the physiotherapy marketplace, it's myself and all the competing physiotherapists around my area, okay? If you want to look at the healthcare marketplace, it's all the hospitals, physicians, physician-owned physiotherapy clinics, chiropractors, massage therapists, acupuncturists, and other PT clinics. That's the healthcare marketplace, okay? We're in an oversaturated market. There's a lot of healthcare providers out there, okay? Physiotherapy is an oversaturated market. If you just Google physical therapy Orlando, there's all sorts of red dots everywhere, okay? So what do we do if we know that we're in an oversaturated market, okay? So the current state of most standard PT clinics, it's still operating out of the old belief system. We just do post-op rehab. We only see Medicare patients. It's the norm, it's the standard. It's how things always were, and we're just gonna keep it the same and do how they're always gonna be. We depend on ACOs and physicians and other clinics to send us patients, post-op rehab. And it's really just a small portion of the healthcare market. Okay, and I like the term, it's an oversaturated red ocean physiotherapy market. And it's kind of, we've all seen this picture on the left, that's from the Virginia Mason study where they're looking at cost effectiveness in their healthcare hospital and looking at taking advantage of direct access to PT for lower back pain. But everyone in standard care is still following that long blue track, okay? And it elevates the cost of care. How many evals do you need for one low back pain patient? So a lot of people are still stuck in the old physician referral model, okay? And really when it comes down to it, if you take a step back, you're in an oversaturated market and you're missing a much bigger market. And the reasoning behind that is there's 3 studies out there, Fritz, Childs, and another one by Fritz, that looked at primary care physicians and are they really referring to physiotherapists? Because we are the musculoskeletal experts. We can show good outcomes, do it better, faster, cheaper, without needing surgeries and injections for most patients, okay? And physiotherapy referrals, 7%, 16.3%, and 13%. So if you're relying on physicians for referrals, you're missing a huge market, okay? And I was at Solar City driving around looking at solar panels and power walls, and I ran into Elon Musk. I asked him this question about an oversaturated market, which power walls and solar panels are really cool, by the way. I asked him about this, and he said, if you're gonna open a business in an oversaturated market with lots of competition, your product or service needs to be far superior than your competition. Not just a little bit better, not a little bit, but it has to be far superior. We're in an oversaturated market. We can't ask someone to pay cash and do the same stuff that we did in standard health insurance care or health care, okay? You have to be, your product, your service has to be far superior than your competition. He created an electric car in an oversaturated auto industry. Okay, So I think he's a visionary genius. It's just a matter of time. And I mean, he wants to habitat Mars. How awesome is that? So, and right now he created a company solving the traffic problem in LA. He's burrowing tunnels to create super speedways to solve the traffic problem. So if you're in an oversaturated market, we can learn from this. Our product, our service has to be far superior than our competition, or you're not going to succeed, okay? So how are you going to stand out in an oversaturated market in a cash-based clinic, okay? How are you going to differentiate yourself from your competitors, okay? There is an absolute fascinating book called Blue Ocean Strategy, okay? It's all about decreasing costs and increasing the buyer value. I love this term. It's called value innovation. It's all about designing a new market, an uncontested market with new market space, and it makes your competition not relevant. And it does this by a strategy canvas. It eliminates the waste, it reduces certain factors, it raises certain factors, and it also creates new things. And a perfect example is Cirque du Soleil. It took a struggling circus environment, that was the circus industry was going down. The theater market was still up. It created a merge of both of them and created a whole new marketplace with no competition. And look at it now. It's thriving, you know. So it took the best and the worst of both and kind of combined them and created a whole new untapped market space. And it's a thriving, successful business. This is what we have to do, okay? So we have to get out of this red ocean, oversaturated market, and we need to create a new, untapped, blue ocean, smooth sailing, uncontested marketplace with very little competition. This is the key with a cash-based practice, okay? You need to separate yourself and be more innovative, show better results, better patient experience than standard healthcare. Not just versus other PTs, standard healthcare, okay? You need to show a new model that is dictated what's best for the patient. And this is where you can tap into the direct access. You can tap into a whole new, bigger blue ocean market. Instead of settling for that 16% roughly based off of physician referrals, you can tap into a blue 70% market. This is just example. And then you can rule out the people who really need medical surgeries, medical interventions, 10% non-responders, people who don't respond to physiotherapy, develop screening processes for that, know when to refer out, because you're going to start tapping into a direct access model, and you need to know when to, you have to have processes with your medical screening and know when to refer out. But there's a whole untapped market out there that you can reach out to in your cash-based physiotherapy practice. So then what market are we really in? Are we in a concierge service market? Are we in a physiotherapy market? Healthcare? Fitness? It's kind of like a new merge of all four of them in, but it's new, it's innovative, better outcomes, better patient experience with less competition, okay? This is essential if you're going to open up a cash-based practice. And the last one is creating value in healthcare and in the public's eyes, okay? We have to create real value. And if you've been reading stuff about business or consulting with other people, everyone says you have to create value. Everyone says it, but no one goes in to define what is value, okay? So we all know what value means to us, but another thing is to take a step back, what I learned from baseball cards. I remember collecting baseball cards as a kid. I was like, oh wow, this Frank Thomas rookie is $60, because I look it up in a Beckett and it says that it's $60. And I'm like, my Cal Ripken Jr. rookie card is $100 because the Beckett told me. But if no one really wants my baseball card and is willing to pay for my baseball card, is it really worth $100 just because a Beckett told me? And that's where I was lost. I was like, man, this card's worth this much, this card's worth this much. But if no one really wants my card and is willing to pay cash for my card, is it really worth anything? So we can learn that from baseball cards. If you don't really create value that no one is willing to, if you create what you think is value, but the patient or the public doesn't see that as value, do you really have value? So Are we currently creating value? Government, advocacy, legislators don't even know what physical therapy is. They think we're glorified massage therapists. They don't really value us as medical professionals, and plus we only have less than 30% membership right now in our professional organization. Insurance companies definitely don't see value in what we do. I don't understand this why. I still don't understand this. I mean, I feel that we can present all the research that we want to insurance companies, showing that we're cost effective. We can show short-term and long-term outcomes. We can show the same outcomes compared to surgery 1 year out. But yet insurance companies still don't see the value in what we do, and I don't understand it as a business, because we could save them money.
I can tell you why. Because there are physical therapists that are charging insurance companies, and they're not showing it's business model, and everyone's looking to make money. And you've got the nursing industry that has been around a lot longer than us. They're integrated and diverse.
Yeah.
So a lot of who's reading most of our notes right now? Nurses. And they're the gatekeepers, and it's unfortunate. But I love what you're saying. These I'm sorry for coming out.
You're okay.
This is wonderful what you're saying. But until we start making changes, and not only have physical therapists that are making decisions in these companies, we want to go with insurance route, great. But even more so, we need to get physical therapists and legislation really makes the decisions on practice.
Yeah, so either we have to fight the fight and commit and fight it and get the funding for it and do it, or we need to be innovative and think of a new way to do it to still treat our patients what's best for the patient. So that's really interesting too. We have to decide as a profession, do we fight the fight and stand up for it and still go that insurance route? And we need funds, we need membership, everything, or are we going to be innovative and adapt to healthcare trends? And Yep. So creating value again in the public's eyes. The public doesn't know who we are or what we do. The public doesn't know about direct access yet. Right now, the public really doesn't see value. It's actually bad that physical therapy is in my business name, because I'm sure a lot of people go to the website or see physical therapy. Oh, I had tried physical therapy before. Oh, I don't have a surgery. Oh, I can do my exercises at home. So in creating value, is it the public's fault that they don't know what we do? If you're interested in business and entrepreneurship, there is an absolutely fascinating, this guy, Tom Ellsworth, in valuetainment.com, he breaks down some of these big businesses and really basic fundamentals for us to understand. This is a great thing. And he was analyzing, I think it was Buffalo Wild Wings, where they were struggling there for a while because they weren't adapting to what their client wants. And he said this quote, "The customer is not the problem. The customer is moving forward in what they want, and you, the business, haven't changed yet. You stayed here and everyone just left you by. So you as a physical therapist, are you adapting to what the patient wants and what the patient needs? Or are we just sitting here complaining and people are just going on without us and the patients are finding other ways to get treatment? So are we really adapting to create true value? So we have to adapt to the current market and new healthcare trends. We need to satisfy what the patient wants and needs. And we need to pay attention to this as small business owners in a healthcare market as physical therapists. So the patient value formula. So now you're going to know exactly what patient value is, okay? Results and the quality of the customer experience is on top. So there's a direct relationship to patient value. The increase the results, the better the results, the more patient value. The better the customer experience, the increase in patient value. Price and additional costs are on the bottom. So the decrease the price, it's an inverse relationship now. The decrease the price, the increase the patient value to a point. And then additional costs, which is time loss, work loss, missed family time. If I can decrease the time loss at work, it increases value to the patient. So now you know exactly what patient value is, okay? And you can take a step back and, am I creating value for my patients? Okay, can I improve my results? Can I improve my patient experience? Can I decrease the cost? Can I make it cheaper for the patient? Can I show better outcomes and decrease the time lost at work, or the missed races, or the missed family time, or the missed running or participation in sports? So now you know exactly what patient value is. And we need to create value. I believe that we need to be innovative. Okay, we need to be innovative like Uber. We need to think like an entrepreneur, like Mark Cuban or Elon Musk, and solve healthcare problems and do what's best for our patients. We need to be cost effective and efficient like Amazon. I believe in more outpatient orthopedics, that we need to create a new model, a new belief, a new way of doing healthcare in the outpatient setting. Can we create true value innovation in the public's eyes? Okay, there's so many studies that show that we can physically show good outcomes, good short-term outcomes, good long-term outcomes, and we're cost-effective. Okay, but in a cash-based physical therapy practice, you need to focus on creating true value directly to the patient's eyes. Outcomes, better experiences, lower cost, and that's what the patient's going to view as value in a cash-based physical therapy setting. And if you can create enough value, they're willing to pay cash for it. Whether they just want to pay out of pocket for it, or whether they're the patient that has the $5,000 deductible and you can get them better, fewer visits, and for a lot cheaper. Okay? I was at a conference in Atlanta. I heard Les Brown speak. He's an awesome motivational speaker. His story is phenomenal. He said this quote, "Necessity doesn't fuel innovation. Refusing to accept things the way they are is the motor of innovation." And we need to be innovative. In healthcare, we need to be innovative for our patients. Are we really adapting to future trends? Are we thinking like an entrepreneur? Are we predicting trends in healthcare and in the marketplace? This is a fascinating book too. Robert Kiyosaki, Rich Dad, Poor Dad. Entrepreneurs have one thing in common. They keep going. They'll change the rules. They'll reinvent the rules. They don't take no for an answer. They don't accept one answer. We innovate, we adapt, and we will overcome no matter what the economy is. Okay? Are we thinking like entrepreneurs as physical therapists? Because hospitals and physicians are adapting. They're using the ACO model. They're buying out clinics. They're buying out physician and physician groups. These huge ortho clinics are adapting an oversaturated market and dominating the market. A lot of primary care physicians are going to concierge medicine or membership models. They're adapting to current trends. My family and my staff are a member of a health share, and we're members of a primary care membership. I even interviewed my primary care physician. Okay, and this is the same stuff of what we're trying to do. Okay, the best thing a family or an individual can do is they need to take responsibility for their health care. Our system delivers convenience and cost effectiveness, but being knowledgeable about the patient with the assistance from MyDirect MD. It's all about convenience and cost effectiveness. I've been saying this for the past hour. They believe that their model for primary care is the future. Okay, in addition, you insure for catastrophic events, not everyday expenses. Your car insurance does not include tire oil changes and checkups. That's interesting. Your homeowner's insurance does not include painting, window washing, or house care. You should not rely on health insurance for primary care. This is a new way of thinking. Physicians and primary care physicians are doing this. They deliver a comprehensive, convenient care model that is extremely cost effective. Okay, on the very bottom, they're free from oversight and hassles of third-party reimbursement and can deliver superior care at a much lower cost. Physicians are adapting, and it gets you thinking. With the current trends that we analyze with healthcare, with high deductible healthcare plans, HSA accounts, is physical therapy going to be considered more maintenance? Are they going to stop covering physical therapy? Are we going to be kind of like the auto insurance, where they're not going to pay for tire rotations, oil changes, but they're going to cover you if you're in a major medical accident? Is health insurance going to do that same thing to us, where they're not going to cover minor musculoskeletal injuries, outpatient physical therapy, but only cover it if you need a surgery or cancer, major medical problems? That's something to think about. Are we going to be left out to the side and just, in a cash-based model? That's great, because you're going to target all these people, and still you're going to get them better than standard care. Dentists are going cash-based. My dentist is a cash-based practice too. Do you really need dental insurance anymore, if you think about it? Trainers are adapting. They're marketing. There's trainers in their Orlando area marketing rehab for post-op patients. They're doing post-op rehab. They're called corrective exercise specialists now. They're doing functional movement screens and functional movement training. They're doing TPI training. There's no restrictions in their practice act. They can do whatever they want, see a patient as long as they want. Trainers are adapting. There's PIP clinics and lawyers making lots of money right now. I see this all the time. I'm not a conspiracy theorist, but I'm just real. This is what's going on. There's lawyers that are seeing motor vehicle accidents, and with PIP coverage, they refer them right to a clinic that has a chiropractor and a bunch of techs. No physicians, no PTs. They bill the, excuse my language, the crap out of physiotherapy, and they abuse the system, and they get their $10,000 of PIP coverage in 1 month, kick them out to the curb, and then they send them to pain management, and then surgery. And then you know what? What's even crazier? It increases the bill, they drain the $10,000, it increases the cost of there, and then guess what happens? The lawyer still gets a 33 1/3. And if we look at it from a business hat perspective, these people are all running businesses. And the end result in the business model of this, the more expensive the cost of care, the worse the patient gets, and the more surgery and injections they need, the more money that the lawyer gets. It's the way the business is set up. So we got to do it better. Okay, massage therapists are adapting. My massage therapist at my clinic is so well known in her area. People go to her for neck pain. Now she respects us enough that she knows when she needs to send them to us or not, and she respects the medical profession enough. But she's so well adapted and well known that people with low back pain go right to her for treatment for their low back pain. Okay, they can do one-on-one care. Who doesn't feel good after a massage? Everyone feels good. They're doing Graston. They can do the instrument-assisted soft tissue mobilization. They can do cupping. They can do myofascial releases. Sounds kind of like us a little bit too. There's a neurocash clinic in Orlando, Florida, okay, that sees neurological cases. They do neuro patients, stroke, TBI, spinal cord, MS, Parkinson's disease, has gait-assisted treadmill walking. Not a single PT works at that clinic. Okay, so we have to adapt. This is a cash-based neuro clinic, and there's not a single physiotherapist there. It's all personal trainers and exercise specialists doing all this stuff on neuro clinics. No one is taking advantage. They have no competition. So there's a lot of people that fail, or they get kicked off of their insurance coverage with these cases, and they go to this clinic and pay cash, and they're doing what we're supposed to be doing. So instead of going after them and complaining about them, someone has to open up a business and do it better than them, because I know that we can do it better than them. We're trained in this stuff. Chiropractors, they're constantly trying to change their practice act, get more power. They have 100% membership, excellent business training. They sell packages for thousands of dollars and see someone for 8 months. I tell my patients, if I'm seeing you 8 months from now, I'm doing you a disservice, because I know that I can get you better in 2 months. Okay? But as business owners, they're very, very successful. So we need to adapt to these new trends. The future of physiotherapy, solving these problems that our patients, they're telling us the problems. We know the problems. We just have to solve them. And we need to do it better than everyone else. We need to create true value, understand and predict trends in healthcare. Because otherwise, how are we going to survive and adapt to healthcare reform? And the question is cash-based the answer? Are we still doing what's best for the patient? Again, if you go back to this problem-solving, remember this thing from back in the day where you had to use 4 lines and try to connect all the dots? You know that the answer to this is thinking outside the box. This is what we have to do. So given everything that we discussed, is there a better way to do physical therapy business? Starting a cash-based practice, being innovative, differentiate yourself. And I know it's scary at first because we're not trained in business, but I know that when you're trying to do great things and push yourself outside of your comfort zone, you're going to have doubts. And if you don't have doubts, you're not pushing yourself far enough. So everyone, when I first started the clinic too, I was like, am I doing the right thing? This is crazy. I'm going to open up a business and ask people to pay cash when they can get it for free right down the street almost. So it's normal to have doubt. It's when you're doing something great, it's okay to question yourself. That means you're pushing yourself outside of your comfort zone. So You know, and then at that same Tony Robbins seminar, he was like, well, if you run back across the coal, I'll tell you another business thing. So I just ran back across the hot burning coals, and he told me this, you know, disappointment is inevitable when you're attempting to do something of great scale. Instead of letting your disappointments drive you to find a new answer, discipline yourself on your disappointments. There's times where people will consult with me, physical therapists, they let one obstacle stop them from attaining their dream of opening a cash-based clinic. They have a location set up and they run into one obstacle and they're like, nope, I'm done. I'm just gonna go get my OCS now. I'm gonna stop, it's too hard. You can't let a disappointment or a doubt or an obstacle stop you if you want to open up a cash-based clinic, okay? So here's 4 principles to thrive in a cash-based clinic and to create true value innovation, okay? Again, we've said this multiple times before. We gotta create cost effectiveness. Since we know deductibles are going up, can you get patients better, cheaper, and fewer visits if you know they have to pay $5,000 cash for their deductible? Can you create cost effectiveness and do it better than standard care? Because with this new market, patients are going to have decisions to make. Do I go to the hospital setting that's going to charge me $5,000? Do I go to the chiropractor for $4,000? Do I go to this acupuncturist for this? Can I go to XYZ physical therapy who's going to get me better in 2 months and is going to charge me $2,400? If I was a patient, I would do that. Instead of just relying on people coming in the door or referrals from physicians, we need to identify prospective patients that will best respond to physical therapy. We know who that is. You know, target your niche market, design strategies to be specific and effective to target that group. We'll see you. Yep. I showed you what exactly the patient views as value. We have to create value in the public's eyes. We need to create value in this oversaturated marketplace. Not what healthcare wants, what the patient wants. The patient, what they want and need is, you know, if we can solve those problems and provide that service, that's going to create value. And patient outcomes, this is one of my early mentors, James Dunning. When I was doing some of his training, he said this, and it sparked something in me ever since then. And I'll never forget this. Don't you owe it to your patient to give them the best treatment possible? Don't you owe it to them to do what is best? And I kind of lived my practice with that principle. No matter who walks in the door, nothing's going to stop me from doing what's best for my patient. So in a cash-based clinic, you have to have superior outcomes and better results. So I highly recommend any of his courses. I love what him and his team is doing. And when I was a new grad, I left his courses and I was in shock. I was like, this is exactly what I want to do. And I love that quote that he said. So in a cash-based physical therapy clinic, it all comes down to what problems are you solving and are you creating value in the public's eyes. So Warren Buffett said this, price is just what you pay, the value is what you get. And again, we need to create value. And we're going to start going into the business side of things. So we kind of analyze the cash-based market, future trends, creating value, cost effectiveness. But everyone wants to open up a business, but not everyone's going to be successful in opening a business. Everyone wants to open a business, but not everyone's going to make it. It all comes down to execution. And if you're interested in cash-based physical therapy, I highly recommend you follow Gary Vee. He's doing some great stuff. And everyone wants to be successful, but are you willing to put the work and the time and the effort and the sacrifices to being successful? Because just because you're a great PT doesn't mean you're going to have a successful business. And next we're going to go into the second half of this. So you can press stop if you want. So what time is it right now?